Dr. Stanley Lang, and welcome to this presentation. This is a continuation on a series of presentations that are focused on whole person health. That's health in body, mind, and spirit. And today I'm going to tell a story about a patient with depression and anxiety. Now, this is somebody that I saw a couple years ago with exactly these symptoms, at which time he had a profound deficiency of vitamin D and vitamin B12. And simply treating these vitamin deficiencies helped him dramatically to feel a lot better. He got in an exercise program, was feeling really well. And then in the last 2 months, he started to feel poorly again. And he came in basically requesting for me to prescribe him an antidepressant because he thought that that was the problem. So I told him about how antidepressant prescriptions generally are a bad choice. And the reason they're a bad choice is because if you look at the statistics, especially with the group that are called the SSRIs, which are the most commonly prescribed antidepressants, the success rate is only 10% better than placebo. However, when people do start the medication, more than 90% of them feel poorly when you stop the medicine. In other words, it didn't really treat their depression, but they feel badly when you stop the depression or stop the medicine, and so they restart the medicine. And so they end up taking the medicine for basically the rest of their lives because every time they stop it, they feel worse. And one of the things that these antidepressants actually do is treat anxiety. They also treat chronic stress, but they don't treat depression very well. So I explained to the patient that that was the probable outcome if he took the antidepressant, and I explained to him the alternatives, which are natural strategies that I often teach in the office and work 90% of the time. As we talked some more, it became apparent that he wasn't really depressed. He was having anxiety attacks, and that was making him sort of stay in his room so that he wasn't doing much because he was having panic attacks intermittently. So we came up with a plan to treat the panic attacks that totally avoided the use of the antidepressants. Now, this is basically one of the major issues in emotional health. And from a whole person health approach, the goal is to engage body, mind, and spiritual resources when you're trying to get better in the emotional sphere. So from the body perspective, he's going to restart his exercise program that he had stopped over the last 2 months because of bad weather. So he's going to really give a lot of effort to the walking vigorously every day. He's going to continue investing some time in his spiritual life to make prayer more of a part of his life. And from the physical perspective also, we're going to make sure his vitamin D and B12 levels are where they need to be, because I have a feeling that he's probably dropped off on taking them and they're contributing to how he's feeling. So the take-home message for you is that if you're experiencing depression, the research shows that exercise has a 90% cure rate for mild to moderate depression, whereas, as I mentioned, the actual prescribed medicines have only 10% better than placebo effectiveness, and they have a slew of side effects, and they have a high chance of making you somewhat addicted to the drug for the rest of your life. So not a good choice. There's a lot of better ones out there. So I wish you well with this. If you want more information on how to live a healthy lifestyle, please click on the link below this video related to the wellness program that I have, and be sure to subscribe to this channel. Have a good day. God bless.